at IPC Health, we were really excited to be part of the Northwestern Melbourne PHN funded Pharmacists in GP Practice project. We saw this as such a great opportunity to extend the services we already offer to the community and provide extra support to our GPs, practice nurses and all of our allied health team. The pharmacist role has expanded over time from medication reviews and patient education to now include being the community and hospital pharmacy liaison, medication reconciliation post-hospital discharge and specialist consultations, on-the-spot medical advice, doing case conference coordination, GP support with SafeScript, administrating vaccinations, development and participation in on-site pain program, education and updates about the latest medication and PBS changes, conducting home visits, doing Webster Pack management, work cover and TAC advocacy, joint consultations with the GPs, looking after medication safety, drug rep consultations, referral support, and there is so much more. Basically anything medication related, we can call on our pharmacist.
Penny has been such an outstanding support to our clinic. She's supported the doctors, the nurses and the allied health team in so many ways. She's just been really invaluable part of the clinic.
We found the practice pharmacist an invaluable source of information for both ourselves in terms of latest drug developments, legislative changes in pharmaceuticals, educational topics on current drug topics, a recent example being the introduction of medications for COVID-19, which is a very topical and relevant area. Topics to be covered as well with us in our education will include medical cannabis use and other areas that perhaps general practice isn't so familiar with, like vaping and e-cigarettes. So these are examples of the ways the practice pharmacist has benefited us as clinicians.
Look, having our practice pharmacist Penny here has been invaluable as I've made that transition from hospital-based medicine to community-based medicine. In a hospital setting, we often focus on patients in a very short-term setting and on one particular problem, whereas in the general practice setting, we're focusing on those patients as a whole. And we do have a number of complex patients who are on a lot of medications, and there are a lot of potential interactions. And I've found that engaging Penny with those patients and asking for home medication reviews has been both beneficial for the patient, but it's also increased my knowledge about certain medications, a lot of interactions between different medications, and it's also increased my confidence in prescribing those medications. So I think that will be really beneficial in the long term for both my knowledge but also the patient's long-term health outcomes.
Penny has provided support to patients directly by giving them education on their medications, side effects and the optimal use of their medications. She's done that, in the clinic environment, which makes it so convenient for patients when they come and see their GP. They also can see their pharmacist, and also often the GP and the pharmacist work together in a consult room with the patient. So it feels very much like a team and a collaboration, and they can go through the patient's medical history and their medication use in a more comprehensive way and in a best practice way where the patient is at the centre of the conversation and is a part of that discussion as well.
Penny, now look, she's been so helpful to me. I've made a few mistakes, of course, in number one, storing some of my medications. She didn't like some of the things I was doing, and she showed me or told me how to correct the proper storage of them. And I think that was the most important thing, because evidently medication has to be stored correctly, otherwise it'll lose its benefits to you. Penny certainly helped me with that, and her advice was extremely good.
She's very professional, very friendly, well-mannered,
and explain.
young lady, and she takes the time to explain it to us.
Every tablet's explained to me.
Yeah.
Plus after 4 days gives her in and say, go and tell you're right and all this. and said, if you've got any problem, ring me again, and all of this. It's very good for me.
If you look at outside pharmacists doing domiciliary medication reviews, that's important and beneficial. But the in-house practice pharmacist doing that has direct access to us as the clinicians, and so we can actually discuss the patient's clinical situation at depth, actually, and they have a better insight and understanding. And I think that improves the benefit and the outcome of the domiciliary medication review.
See, one of the things that a lot of clinics should have, from my point of view anyway, is the pharmacist on the premises. You can ask the pharmacist and get more information on what the medication is going to do for you.
He's very happy with both the pharmacist and the doctor. So working together, it's an advantage, if we can put it like that.
I think it's absolutely marvellous. You've got two people working together for the betterment and recovery of their patients.
Penny has coordinated and participated in many case conferences, especially those of patients who have really complex medical histories and needs. This often involves Penny herself, the GPs, specialists, allied health members, and often the patient is also involved. This is an excellent collaboration between the patient's care team and to provide care in a very holistic and integrated way.
The practice pharmacist has also reinforced our clinical management of patients in a really productive manner. And a key example of this is in the use of S8 medications and patients who have problems with opioids and benzodiazepine use. Our practice pharmacist has been an integral component of our managing these patients. She has reinforced positive educational messages. She has assisted patients with the negotiation of practice contracts so that we can step down medications in a controlled manner. She has presented evidence to patients about the relative inefficiency of opioids, for example, in chronic pain, many chronic pain states. As an extension of that too, our practice pharmacist has been involved in developing broader pain management programs in conjunction with our social prescribing team. So that has been extremely beneficial.
Power Over Pain is a program to support people with persistent pain and also people who are at risk of developing persistent pain. With Penny working with the pain clients, we are often able to reduce their reliance on medication because really, once they understand that the medication is not the answer, then they're often willing to look at other ways to manage. So, and sometimes that takes a while. Sometimes it takes years actually for them to recognise that no medication is going to fix them. And then they're often open to new ideas, and that's where Penny steps in and says that. So, we have managed to wean quite a number of people with Penny's help off some of their medications and introduce them into other ways to manage their pain.
She's been invaluable in assisting us with the electronic prescribing program and the nuances around that. She's assisted us with various problems that we've encountered on occasion with the SafeScript program and the logging of prescription and dispensing data in that, and has followed up with pharmacies regarding those issues.
In this practice we see a huge variety of patients. I've been exposed to a lot of different medication regimes. A lot of patients have different specialists who have prescribed a variety of medications I may not be quite as familiar with. And having patients with chronic pain, Penny has also been invaluable in providing me with evidence-based strategies to manage these patients and to optimise their long-term health outcomes.
As Penny is also a pharmacist immuniser, because she's just so talented and can do so many things, she's been able to support us, been a great help during COVID vaccinations and also during flu vaccinations. So having that extra pair of hands has been so helpful. It freed up our practice nurses to be able to provide the care to our regular clinic patients in the treatment room and to perform care plans. So that's been super helpful.
So being in the community health setting, I guess has made it a little bit easier for us to access a practice pharmacist. The key issue with broadening this concept and introducing a practice pharmacist to every practice is the issue of how is it going to be paid for? How are we going to fund this? Really, the financial benefits are hard to measure in monetary terms. I mean, how can you actually measure this? How do you measure, for example, the benefits of assisting patients wean off opioids and benzodiazepines? You can't measure that readily, but the benefits are there. So benefits for the patient, benefits for their family, positive impacts on their employability and general social ramifications of that. That's hard to measure, but those impacts are real, and those impacts do happen through our practice pharmacist.
The best thing with Penny, I think it's the overall care that she has for her patients or her what customers, whatever you like. She gets involved with their treatment, and when they talk to her, they tell her, like I do, how I feel, how the medication maybe is or maybe isn't working, or whatever the case may be. And she's a very good listener and a very good advisor. And she will advise you on the best way to look after yourself.
Very good. I'm very pleased with Penny because it's very professional. It's got a good manners, explain nice, got a plenty of time to explain everything. And I'm very happy.
Having a practice pharmacist has been an incredible support to our clinic, not only to our doctors, our nurses and our patients. One of the great benefits also is that we were able to increase our billings in the clinic. We were able to recall extra patients for medication reviews, increase in home medication reviews, the case conferencing, and in addition to that, more vaccinations as well. So that's definitely a massive benefit to us as well.